Hello, my name is Dr. J. Michael Bennett. I'm a orthopedic surgeon specializing in sports medicine. Today we're going to go over the A to Z in the shoulder. I'm going to try to really explain as much as I can in regards to shoulder pathology in this short segment. Now, another type of thing you see in the shoulder too is the biceps tendon here. This can be a source of pain as well. The biceps is this little tendon here in the front of the shoulder. It's basically the size of a fettuccine noodle. This thing is very, very thin and small, and it actually inserts to the big muscle of the biceps. So a lot of people actually rupture this or actually can dislocate this or have it fray or torn and actually become pretty inflamed. So what we can do for that, if it is something that's symptomatic and bothering the patient, sometimes we do what's called the biceps tenodesis, where we actually release this tendon up top here and then put a screw down here and hold it into place, okay? And that keeps the biceps in place and actually helps with the pain. Now, sometimes where the biceps inserts down deep into the shoulder joint itself, it's called the superior labrum. Now, we see this in throwers all the time when they're rotating their shoulder and they're throwing extensively and chronically over time. You get a lot of stress on that biceps anchor. And if you look at where the biceps inserts, it's at the top of this glenoid, which is the socket of the shoulder joint. You got the ball in the socket, and the socket looks like this. It's almost like a little bit of a golf tee, and you got the labrum up top here. And you can get a little tear at the top of the labrum where this biceps inserts, kind of right in this region. So sometimes we have to actually fix that with anchors, again, that we put through the bone and wrap it around the tendon and hold it in place to help that heal and take care of some of these popping and clicking symptoms that these throwers are exhibiting. If it gets really, really bad, again, the other option is to release the biceps up top and then put a screw down here and do what's called a biceps tenodesis. So in essence, that really kind of glosses over some of the basic rotator cuff type of issues and biceps issues.